Why do Parkinson's patients suddenly freeze while walking? Imagine walking along and suddenly feeling like your feet are glued to the floor, unable to move forward. This experience, called freezing of gait, affects many people with Parkinson's disease and can be very unsettling. It often happens unexpectedly and can last from a few seconds to over half a minute. Understanding why this occurs involves looking at how Parkinson's impacts the brain's control of movement. In Parkinson's disease, certain brain areas that help us move smoothly and purposefully don't work quite right. Normally, walking happens automatically, without much thought. But in Parkinson's, the brain has to work harder to coordinate each step. When it struggles to do this, freezing episodes can happen. The main problem involves disrupted communication between parts of the brain responsible for initiating and controlling movement, especially the basal ganglia, which act like a traffic controller for movement signals. During a freezing episode, the brain's pathways that normally allow movement become overly restricted. This overinhibition prevents the muscles from starting or continuing movement, even though the person wants to walk. Think of it like a traffic jam in the brain that blocks the flow of signals needed to move your legs. This is why the feet may feel magnetized to the ground, as if they cannot be released to take the next step. Certain situations tend to trigger freezing more often. Turning corners is a common trigger, as it requires a change in movement pattern. Walking through doorways or narrow spaces can also cause freezing because they challenge the brain's ability to adapt quickly. Starting to walk after sitting still, called gait initiation, is another common time for freezing. Stressful or hurried situations, such as rushing to catch a bus or walking in crowded places, can make freezing more likely. Moving from one surface to another, like from carpet to tile, can also cause a temporary freeze. Freezing can be influenced by medication timing. When Parkinson's symptoms are not well controlled, especially just before taking medication, freezing episodes can become more frequent. Sometimes, even long-term use of medications like levodopa can lead to increased freezing, adding to the complexity of managing this symptom. Certain factors increase the chance of experiencing freezing. Men, those with early gait problems, higher doses of medication, or additional non-motor symptoms like anxiety or depression are more prone. As Parkinson's progresses and symptoms become more severe, freezing tends to become more common and harder to manage. Attention plays a big role in freezing. When a person is distracted, anxious, or multitasking, their brain's ability to control walking is compromised. Using visual or auditory cues, like focusing on a line on the floor or listening to music, can help reduce freezing episodes by redirecting attention and activating alternative pathways in the brain. Understanding freezing of gait highlights how complex Parkinson's disease is. It involves not just motor control but also attention, perception, and environmental factors. While medications can help, they don't always fully prevent freezing. Safety measures, such as using visual cues or walking aids, are important to reduce fall risk. If you or someone you know experiences freezing, consulting a healthcare professional is essential to develop personalized strategies. Remember, each person's experience with Parkinson's is unique, and managing freezing often requires a comprehensive approach tailored to individual needs.